If you had $100 million for healthcare AI, where will you put in first and where will you stop investing?
I think one of the things that I would stop funding is the data projects that don't tie into real operational decisions. In the healthcare, what I've seen working with customers is they've built either some dashboard people admire, but they don't use it really. We know that dashboards are not the outcomes, right?
Why do we let it fall in the water? I'm just curious, what's your take on that?
You want to spend more time on that versus a technical system. Being right is not enough. You have to earn that trust. I think that's the other piece here. I think healthcare is slow because people don't want to innovate, but that's not true. I think healthcare is slow because the stakes are human, right? That's the biggest misconception. I would reboot the front door of healthcare, the navigation experience.
Everyone in healthcare talks about AI, cloud, and data. But there are very few leaders who have lived the full arc. Prathima is one of them. She has moved from bedside to the boardroom, from medicine to tech, and today she leads healthcare for one of the most influential AI ecosystems in the world, AWS. Prathima, super to have you on the gig. Welcome.
Thank you, Praveen. Very excited to have this conversation with you today.
Absolutely. And we'll still have this conversation even when I know you're a Warriors fan and I'm a Spurs fan. That's all right.
That's right.
Cool. So here we go. If you had $100 million for healthcare AI, where will you put in first and where will you stop investing?
That's a great question. I would say today the healthcare is so fragmented, right? It's flooding with AI pilots. I think where I would really try to put in this $100 million is on the front door, the healthcare delivery side. One is the access, giving the right data to the patients, being able to provide that right access and also, provide the right care at the right patient. Today, if you look at the patient's journey, it's they have to repeat the same things again and again. Many times the data doesn't flow with them. I would love to create like a patient journey passport that can help them take all their, whether it's their medication history, whether it's their diagnosis, everything sitting in one place, which is all integrated and providing that right care.
We'll come to that patient journey passport. That's intriguing to me. But let's start somewhere more fundamental. So
Mhm.
you move from medicine to tech, and I did that sort of migration, if you will, many years back. And was it a moment where you realized that technology is such a crucial vector in how medicine is, even studied and delivered today, that without that, healthcare almost can never be transformed? So what's your sort of your take on it?
I'll be honest, it's very personal. I'll tell you, coming from India, when I started my journey back in 99 in US, my husband actually played a huge role in opening my mind to technology. After his grad school, he worked at Cerner Corporation. So he was the one who told me there are many physicians who are moving into healthcare technology. And at that time, I personally didn't know many physicians who had taken that path. It was very unfamiliar for me, but at the same time, technology always excited me. I'd seen how the fragmented healthcare was. Patients were constantly, repeating their stories. Like I mentioned, clinicians were trying to make decisions from different scattered data points. Maybe it's like one visit of a patient to one lab, one claim. So I knew, there is a huge play for technology that can support a function in healthcare where it can help bring that everything together in the operating model of care. So for me, I'll be honest, the goal was never like technology for technology's sake. I always wanted to be in a place where I can be a part of that connected, more intelligent, more human. Of course, technology being able to provide that back to our patients, who's sitting at the center of the healthcare business today.
So was medicine was an accident or a design for you?
Actually, very interesting. So growing up, I was very determined. Most of us who have grown up in India, we're very hardworking, right? And I was always like one of those kids who had that white coat aspiration. So that kind of drew me, because one of the things I'd seen, one of my aunt was a physician, what that white coat represented, right? It brought in the trust, the service, the responsibility, and being there for people at some of those vulnerable moments in their lives. So I knew I always wanted to be a physician, but at the same time, I didn't. What really changed over the time was the scale of that dream. Initially, I wanted to help one patient at a time, but later, as I moved into technology and now with the cloud, AI, what I've realized is I could still be serving healthcare, but in a way that could impact clinicians, patients, health systems at a much broader scale.
Medicine teaches us like things like like empathy. How do you deal with nebulousness? And tech is about systems thinking, scaling, and whatnot. So,
Yeah.
have you seen yourself, when you were a practicing physician and what you are today? Have you seen changes in yourself and how you do what you do?
100%. Praveen, especially being in medicine for so many years, right? Medicine will give you that humility that you bring in, often, especially making those decisions when you have that incomplete information, right? But technology, what it does is it gives you that discipline, because you have to build those systems which are secure, reliable. I think being a part of both sides of the world, from growing up in India to living my life more than half of my life in West today, I would say, healthcare is going, especially in the India, what I've seen is you've seen that family, the community, the access, the trust, all of that, which plays a huge role. But in US, it's all about the workflows, the reimbursement. I would say, medicine kind of teaches all that empathy and uncertainty, but technology will help you take that to the next level, which is scale and systems thinking. So I feel, very privileged that I've lived both sides of the world, and I know you as well. So we've seen some things that has worked, but at the same time, I think medicine definitely teaches you, which is the empathetic side of the person, which I think is probably innate in me. And now I take it to the technology, because I think I was telling you when we first met, right? Today, with my role, when I talk to my customers, I feel like they're my patients. Every one of them come with a different signs and symptoms as a patient we would see, but today my customers come with different requirements. So again, you have to treat them individually, right? You can't take the same treatment across the board, which we did in medicine. So I think there are certain places which we could take it, but again, being customer obsessed, understanding what they need from technology perspective makes it much more compelling.
It is, and we'll unpack that. That's an important part. But what were you like a kid? Like curious, competitive, quiet? What were you?
You'll be very surprised. I think I was one of those restless kids, I would say. I always was very resilient. I was always taking a lot of risk. I mean, growing up in India, I'll say I played like probably 10 different sports in school. I wanted to do everything and anything. I was part of a girls' school growing up. So I think that gave me a lot of resilience very early on. I learned also growing up in India, I think that's something you learn to adapt. You kind of work hard, you kind of respect education, you kind of also navigate a lot of the uncertainty that comes growing up. So I feel like, definitely that I've taken some of them even today. If you look at my career, I've taken paths which is not the normal physician route, right? I've taken risk. I didn't know the path when I first started on the technology side. I carved the road, but it's been very fulfilling. I think that's my probably my superpower, which if I look back all my last 50 years, I feel like I always love to take risk and do something which I love to do.
No, it is. I think you're right, bang on right. I think the fact that you made that choice so early in your career and even in the different times, if you will. And those were the days when technology was not even the sort of the mainstream, if you will, right? We're talking about sort of pre Y2K, if you will, right? So the Yahoo Messenger was our tech, or the most tech that we actually ever used. So you're right on, absolutely.
Yeah.
And tell me one thing, that change in the path.
Hmm.
I know you talked about your hobby at Cerner, and sort of he started to sort of get you to see the different plays. Was it when you started to see that? Was there a sense of fear that you're sort of dabbling into something which is you haven't sort of professionally been taught?
Correct. I'll be honest. I still remember the day when I was deciding, hey, is this going to work out for me? Is this a path? Like I mentioned, I didn't know anybody. But one thing that I always knew was if this path doesn't work, I know where to go back, right? The fallback plan was always there. I did have butterflies. I'm not going to say, like, oh, I was all ready to take the world. But, I knew the fallback plan was also there. So that's why I was able to make that switch, moving away from that traditional clinical path into technology, even though, I didn't know if that was the safest choice. um, but in the hindsight 2020 today, it kind of looks like, yes, I'm glad I took the risk. I'm glad whatever I've achieved and wherever I've come through, I've learned so many things in my life that I probably would have missed out just doing the patient care along the way.
No, certainly. I mean, you had an incredible journey. So let's switch to and talk about AI. We
Yeah.
can't have this conversation without talking about it. And I have several questions to that. But let's start with the very basic one. I mean, we see so much of talk of Copilot and autopilot and workflow systems and data platforms. Are there very fundamental things in healthcare that still are being misunderstood about what is AI and how it's getting used today?
Yes, 100%. I think healthcare is still treating AI too much like a tool today. And there's not enough like a transformation. We ask, right? Like, can AI summarize this note? Can AI answer this call? Those are all very useful questions in healthcare business today, but they're also very small. I think the bigger question is, can AI redesign the experience of care, right? Can it help the clinicians be more present with the patient who's sitting in front of me? Can it really help the patient understand what happens next? Think of it, you as a parent taking your child. Sometimes you have to deal with all the traffic, you have to find the parking spot, and then you go sit down with this physician. By the time you start explaining it, sometimes the stress, right, you may not even be able to listen in the whole conversation. And then you go back home and you're like, okay, what were some of the things that I needed to do and follow up? So I feel like, if we can help connect all that documentation, whether it's coding, claims, all of that, there is a huge potential. But at the same time, we all know, right? AI scribe is taking a lot of momentum today with all of the AI pilots, and a lot of them are in production today. But that note taking is only an artifact. The real opportunity, what I see, is the conversational intelligence. How can you help turn all that clinical conversation into something that can support, whether it's before the visit, if I can have a patient summarization before I walk into the patient's room. During the visit, if we can use the ambient and help me reduce all those tasks that me as a physician want to do, right? So AI should not just make the broken workflows faster, but I think it should help us redesign some of the patient and the clinician.
So last week I had a guest and I asked him this question I should ask you as well is let's sort of step back and talk about how much money we spend as this country on healthcare. It's like an insane amount. We're like the third largest GDP, whatever 5.3 trillion some number. And so do you think AI will help in some way fundamentally rewire the cost of care, or is it all about productivity lift, more patient face time? Not that that's anything wrong, you should have that, but I'm just curious, is that number of 20% GDP,
Mhm.
At some point of time, it's just going to be very, very hard to manage and even uh, afford.
Yeah. I think AI can definitely reduce the cost of care, especially in my current role. I'm seeing all the ROIs, right? And definitely the reason why we are seeing a lot of the AI adoption into production is because of the reduction in they're seeing the ROI. But only if you can aim it at the real cost drivers. You have to make sure that AI doesn't come in and do another new shiny object like another dashboard in the system, which doesn't really drive the cost, right? So the bigger opportunity here to reduce the cost should be, how can we help reduce that duplicative work, whether it is reducing that administrative burden, like giving back 2 hours of physician in the day, so that they can focus on patient care and maybe see more patients, right? Even the prior authorization friction. So these are all the other use cases that we are seeing, but also it has to be at the preventable prevention angle. If AI can literally look at identifying all those risks early on, if we can help patients, even between the visits, and have some care teams intervene like before the disease gets worse, so that we don't want the patients moving into ER versus we want to provide them the actual healthcare. That's where I think the economics can really change to reduce the cost.
You sit at a very unique intersection, given the just the expression of AWS across both domestic US and even international markets. So, are there any patterns you could share where these is how and where we are seeing success, where healthcare clients are in meaningful way using AI to do things the right way, versus the ones which are sort of stuck in what I call like a palette paralysis?
Mhm.
Any nuggets there?
I'll say that we are seeing a lot more traction on the administrative use cases, because clinical use cases, again, it's tricky, right? As a physician, it can be sometimes the same patient coming in with a similar symptom, but you have to make different decisions based on if this patient is an elderly with a fatigue versus a young patient who's a fatigue. So the most adoption where we are seeing is ambient documentation, because definitely, like I mentioned, it's going to help with reducing that administrative burden. We're seeing on the clinical summarization, medical coding is taking a huge uptick, I would say. Patient access, we're also, we launched something around the call center, contact center solution with Amazon Connect. That's another place that I'm seeing, especially verification, appointment scheduling, administrative automation. That's where we're seeing a lot more AI adoption.
And if you sort of fast forward, say 3 years,
Hmm.
do you see things which will be completely different in how we do things in, let's say, with a health system? I mean, which are completely unimaginable.
Hmm.
It's like humans taking a call from a human.
Yeah, I would say, I mean, human in the loop is not going to go away at all, whether it's 3 to 5 years. I think we do want the physicians to be in the loop. We want them to make the final call. The only thing what I can see in the next 3 to 5 years, the changes could be is reducing some of those friction layers, right? Like I'll give you an example. Maybe it's the prior authorization. That could be a huge opportunity where AI could come and make a play. Today, as a physician, we have to back and forth provide that clinical context to the utilization management system on the payer side, and then sometimes they don't have enough clinical context. It comes back and forth. Like, it's very frustrating for clinicians too, and also it's pretty expensive for the system, right? So I think that's where we're going to see where the AI can completely reinvent next 3 to 5 years. I think it can help reduce some of those frictions, and more importantly, making sure that we have that connection around the workflow between patients, payers, providers, all of them together. I probably think that's probably going to be what the next 3 to 5 years we'll see.
Absolutely. I was talking to the CEO of a 70,000 member MA plan, and he was sharing the seniors mostly. old age or seniors, like 70, 75 plus. Like average member is on 30, 35 meds. And he said it's just wild because you have these five or six physicians, cardiologists, pain physician, PCP, pick one, PT, and everybody has sort of prescribed certain things. And there is no one common layer that sort of looks at that prescription and saying, hey, here's what needs to get done. I mean, there's one CMR that happens one in a single year. And he said that sort of just makes him wild about how do you sort of figure out just a way to reduce that cost. So to your point on administrative use cases, and I agree with you, I think those are easier one to tackle than the clinical to start with.
Mhm.
But at the same time, is that enough? Because if 80-85% of our cost of care is still sitting in on the sort of the clinical side, would the 10-15% give you enough of a lift, or is it just the convenience factor to get it started there?
I mean, let's be honest, Praveen, in healthcare, we all know, right? It's a crawl, walk, run journey. You have to get started. Probably administrative use cases is where you're going to start. In my earlier role, I've deployed EHR applications on AWS onto the cloud, right? So, same thing, our healthcare systems are, there's so much more for them. Like they have to look at the margins, they have to keep the light on with all the operational work that they do, right? So it's probably, I would say, the crawl, walk, run journey. If you look at it from that perspective, administrative probably is the crawling phase, and slowly as they see the ROI, I think eventually we may get there. But again, we also have to work around the longitudinal context, right? Around the patients, and it's also different systems. We all know how the EHR system works in the hospital system. So there's a lot of things that we need to work on. And I think we're probably, like, if you asked me a year and a half ago, we were still in those co-pilots phase, right? Today we are getting into production and we are already having those conversations. We have customers who have started deploying. So we're still in the crawl phase, I would say, but definitely there's so much room and there's so much to do. I think technology is not the problem. It's the people, the processes within the organizations that have to come together to make those changes.
You're right on. I was reading this report recently and they talked about like the 80-87% of the reasons why projects are failing today
Mhm.
is because people have spent a good amount of time on use case, the specificity, and the tech need of that use case to get enabled or deployed. What they figured out is how the work gets done today, by who, at what point of time, and how will that change if this new thing comes along. So right on. So Pratima, if someone was to hire you as an AI chief tomorrow morning, what's the first thing you will stop investing in?
Great question, Praveen. I think one of the things that I would stop funding is the data projects that don't tie into real operational decisions. Today in the healthcare, what I've seen working with customers is they've built either some dashboards, that people admire, but they don't use it really. We know that dashboards are not the outcomes, right? What I would really work on is shifting that investment towards the data products so that directly I want to see that integration of the workflow. I think we talked about earlier, right? Patient access, whether it's the quality, medical coding, look into all the care gaps. What are some of the clinician burden that we can reduce, even on the patient engagement side, right? That can help on the prevention and care coordination, especially with the secondary conditions. So tying it into the workflows is what I would make the first data investment. Again, the question I would ask is very simple: who is going to be using this data? What decision does it change, and what are some of the outcomes that we are looking to improve out of it? If we can't answer that, we should rethink the whole investment from the data
There's
investment
a lot
side.
of talk about Prathima in the last maybe 2 quarters or 3 quarters around context. The data is important, bring it together, stitch it together, etc. But if the context is missing, to your point, earlier point on longitudinal context,
Mhm.
then sort of it loses its sort of usefulness, if you will. Tell me about what are you seeing in that space on the semantic layering, the context engineering, how is that shaping up in what you see in here, both in domestic and even international markets?
Yeah, I mean, semantic layer is probably very important. I think that context is almost, I would say, the foundation in healthcare, right? Because in healthcare, it could be the same data point, but it can mean different things, whether depending on the patient, depending on the specialty, even it could be depending on the condition and the care setting. This is especially very true if you're looking at all those clinical conversations. Like, I think I was talking about it. Like, let's say a patient comes in saying, I feel very tired, but it could be anemia, it could be depression, it could be heart failure, it could be even a medication side effect, right? Or it could be a poor sleep pattern, that, or somebody, maybe a caregiver who is burnt out. So sometimes I think that's the piece that AI needs to understand, not just the words but the clinical meaning behind the words, right? So I think semantic context is almost like the foundation. So as we are seeing the AI move into all this summarizing information, what we are recommending actions, especially on the workflow orchestration, semantic meaning becomes almost like a safety requirement. It's not like a technical nice to have. It is essential for building that trust. And it's almost like the job zero for providing that healthcare to the patients.
And just in that context, if I may ask a controversial question, and you
Hmm.
can so choose to plead fifth if you want to, but I'll still go ask. So, who in your mind is going to own the orchestration layer? Is that Epic, hyperscalers, some of your friendlies in the market, an AI native app, startups, or someone else that we don't even know who exists today?
I think it's not going to be one organization. I mean, everybody has to work together, right? As much as we know EHR is probably heart of the system, we also want it to be on the cloud. It probably comes. Each one will bring in different layers. I would say, end of the day, the organization has to make the decision. What's the right fit? I cannot see myself like having one over the other. We need all the players, and we need to make sure, end of the day, the customer makes that decision. And that's how I see it.
To your point about customer makes a decision, if you think of these technologies, the data, the AI context, what have you, has just exploded
Hmm.
and exploding.
Yeah.
So if you are a health system or a health plan, what have you, how do you make those choices or build, buy, or something between those two? I mean, what are you seeing how clients are doing that today?
I would say the first question is, creating that strategic differentiation, right? If it is very core to your operating model or like competitive advantage, then you may want to build, or deeply you want to customize it. But if it's something like a common capability, it's better to buy it off the shelf, because it's much faster and it's also safer because many people have already tested it. However, in healthcare, right, build versus buy is not just a technology decision, I would say. You have to consider like the data control, the integration complexity that comes with the security, the compliance, the clinical safety, right? All of that, the workflow that needs to fit in. And who is going to maintain it, right? That's the piece. I think the wrong question would be like, can we build it? Instead of that, I would say the better question is, should we own this capability, or can we operate it safely at a scale? I think build is what differentiates you, but I would say buy is what can help you accelerate faster.
Good answer. And then maybe in the same vein, there are choices around commercially available both models and data platforms and context layers.
Yeah.
And there's a lot of open source today, and quite credible open source options. So I'm just curious: are you seeing where clients are saying, "Hey, for this kind of ability, let me allow my team to sort of start to use open source versus go to commercially packaged software or AI, if you will"?
100%. I think one thing I've learned over the last few years, and also I think it goes back to being a physician as a one thing we want to do to our customers is the right thing, right? Here we are not like wanting to sell just our cloud or generative AI products from our wherever we are part of, right? End of the day, we want to do the right thing. If it's the customer who's trying to look at some solutions which can help with open source solutions, then I mean, we work today, even in my role I work with both SIs, ISVs, and sometimes we may have a competitive product that we have built, but at the same time we give this whole plethora of things to our customers so that they make a decision. I'll give you an example, right? Today we have our health lake offering, which is more like our data foundation layer. But at the same time, if our customers are using Snowflake, Databricks, hey, we have those capabilities that we can integrate and make it better. So I would say, with the models too, you want to lead with the problem, the workflow, and not like just talk about what is that model that's going to solve. Like, we want to make sure that we can help them solve that healthcare problem, right? Because healthcare buyers, they want to know what is that safety, what is that, how do we help protect the data, how can we help that compliance, what is that measurable value, all of that we want to make sure that they understand.
I was speaking to the CEO of a large health system on the eastern seaboard just probably a month back, and he said one of his guidance to his team was pick up the most routine use cases,
Yeah.
pick up the ones which have most human labor associated with it, both in terms of effort and cost, pick the easiest one to deploy it in 90 days, and keep repeating it.
Yeah.
So he said, don't get into this very super scientific paralysis analysis of here's the ROI, etc. He said, if you done things right, you will make some missteps, but you will eventually get it. And what he was, I think, was trying to tell us is was create a good on ramp, a reliable on ramp where people can start to observe and see what works, what doesn't work, and whether it can be supply chain, HR, it can be clinical administration, patient access. It'll start to roll. So it'll start to create like an enterprise momentum
Hmm.
versus sort of this, scattershot. Hey, the teams came to me. Let me pick up which ones to make sense and just start to do it. Absolutely. You talk
Absolutely.
about working with SIs and
Hmm.
startups. If I were to ask you about the expectations of buyers, of sellers. So we are in the selling organization. So curious, what are you seeing where buyers are saying, I wish this is what people are who are selling comes to me with. So if you were to going to give some advice to the startups or ones who have been relatively successful, what would you tell them today?
I would say, today it's probably still the same sales cycle and the selling motion that has not changed much, but I think we're moving at a very fast pace. I'll be honest. Most of the customers that I talk to, they tell me that they're not able to keep up with all the changes that's happening, whether it's generative AI or everything that's happening today in the healthcare business too, right? So I think one of the things what I have seen is giving them the information and helping them understand makes it much more easy for them. And also, in healthcare, right, Praveen, nobody wants to be the first. They want to know where we have customers who have already deployed. Or the good news is, we can always do some proof of concepts. We can show some of those success metrics, bring in all that ambiguity, see that performance, see that security, all of that comes in, and then help our customers understand, why we are trying to help them solve some of their priority challenges.
I was looking at this, and maybe I can call Amazon as sort of insurgent in healthcare.
Hmm.
And there were a few attempts by several of the big players. Big Best Buy tried it, etc. So I'm just curious. I'm fascinated with the fact that there are big enterprises which are trying to come in and sort of disrupt some basic ways of how things can be done right or done better. So if you're to ask, let's say either Tesla or Apple, pick one, and say here is something for you to go and do and disrupt, where would you think those two guys, either Steve Jobs or Elon Musk, will go and say, hey, this doesn't make any sense. We need to, when we land the rocket, we land the rocket. Why do we let it fall in the water? I'm just curious. What's your take on that?
This is a very interesting question. I don't know if I'm going to get into some good discussions here. Look, every company has its own superpowers, right? Like Tesla, the way they, whether it's the cars or the way they send it, like, they have a totally different superpowers compared to the Apple, right? And again, today I'm a big I own Tesla car at home. I use iPhone, the latest version. And trust me, I cannot live without both of them, right? Because I've gotten so used to, and I'm literally, if I get into another car, not that I'm trying to talk or sell more Teslas, the
You
thing
sure can. Please do that if you want.
the thing what I'm trying to say is you just get used to things that this is our human mind too, right? And look at, we get used to, like, if you ask me to go now change into Android, it's really the whole user experience changes. Not that one is right or wrong, it's just the way I think what they come up with their own superpowers and provide those functionalities that people get used to. And I think there's a lot of reason why we have so many users, especially on the iPhone and again on the Tesla sites too. Like every second car I live in California is a Tesla car, right? you know i I think that's where I see,
Tell me about what has been your most surprising failure? And more importantly, what it actually taught you about you.
Oh yeah, I think a lot of my journey has been couple of failures. I think surprising failure is not just being right all the time, right? That's not enough. I'll give you an example. When I worked at Cisco, we built telemedicine solutions. This is back in 2014. I worked with Lucille Packard, the head of urology, Dr. Mike. He wanted to see his patients sitting at Lucille Packard and his patients in Monterey Bay. As a physician, I just loved the whole workflow, how it was integrated. It seemed like a perfect telemedicine solution, but at the same time, we didn't know how to get paid, right? Like the physicians didn't know. So I think one of the bigger things, what my learning is, you sometimes feel like you have the right technology, the right strategy, the right timing, but again, sometimes you need to align, whether it's how can you scale it, because transformation is all about that trust, the communication, the incentives, who's going to adopt it, right? That's what I feel. Those are some of my learnings. Especially it's also true in healthcare AI, right? The best product may not be the one which has the best model. It could be the one that clinicians who can trust. It has to fit it into their workflow, whether it's their EHR system that they use today, and that makes that patient encounter better. So I think that has taught me a lot of good learnings. That hey, human system is much more important. I think you want to spend more time on that versus a technical system. Being right is not enough. You have to earn that trust. I think that's the other piece.
Let's just stay on that point. I think you said something profound there. So, are there things that you considered were very cardinal in healthcare, and maybe a few years back, and today with AI or new tech, you're saying, hey, these should be reimagined in a very fundamental way, like
Yeah.
basis assumptions of how we even teach kids new medicine or practice medicine or manage the finance of the medicine, if you will.
I would say couple of years ago, even with practicing medicine, right? The technology readiness was some of the biggest barriers, right? Today, if I look at it, I think the barriers are more around organizational readiness, right? Technology is moving very fast. Even the healthcare, how they are taught in med schools are very different from what you and I probably went like 25, 27 years ago to med school, right? Things are much different, because of the technology that is making that huge impact and also moving at a very fast pace. I think what I would say is, even though there are changes, I think how can you quickly adapt? I think that's the piece that we all have to learn is even with generative AI, I'll be honest, today I use it almost like on a daily basis. I have created these agents, even though I have no technical skills. We have something called Kiro internally. It runs, it'll do all of my administrative tasks, like pull me a data for all the opportunities that is, whether launched or if I need to know anything around, like, how the Slack channels go crazy on a day-to-day basis. First thing in the morning, if I have to use something like an agent to pull up, I think that's the piece that I'm trying to say is, hey, this is going to be the norm. We just have to get on it and use it in a way that we can be more efficient. And I truly feel I'm not the most technical person, but if I can do, anybody can do, use these agents, make it like, much more powerful, and, so that I can focus on different things like creating more, innovative products and talking to more customers.
All right, let's bring out the operator of within Prathima. So, say if you were running a health system today, what would be some of the sort of first three bets you will make?
Um, I would say I would really would love to start with the data, because end of the day, I think today that's one of the biggest pain point is the data being very fragmented. How can we bring the data together, whether it's like 10 different sources, and maybe, drive the analytics out of it so that it can make more sense for the physicians to provide the right patient care at the right time. So data analytics and, of course, being able to provide that patient access. Even though we are in this country, we all know, like, hey, even to get a specialist appointment, like in the Bay Area, sometimes it can take 4 to 6 months. How can we do that better, with the technology? So those are some of my big bets.
Good. I was hoping not to hear the dashboard, which you actually said.
Yes.
Good. So, tell me, so if say 5, 7, 10 years horizon, are the things you see will fundamentally look outrageously different from what it is today?
I think I told you when we first started, right? If you give me $100 million, what would I do? I would love that to see that in the next 10 years, right? I would love every patient to have an AI powered, whether it's a passport or a health advocate, whatever we're going to call that. you know Today, it's very hard for them to understand. If we can help through that, AI powered health advocate, help them understand what their records are, how can we help them manage those medications, follow up coordination, even like simple things to navigate our insurance, right? It's very hard. Like, I myself won't know what is my copay look like. If we can help connect all that, what it happens in daily life with the things that happen in the clinic, that would be a great thing for a patient side. However, on the physician side or the clinical side, I think is what I would love to see is every medical conversation can become that intelligent starting point for care. It's not just a note. It should trigger for the right follow-up, right? Whether it's the right coding, whether it's the right care coordination, or even like patient education. That's a huge piece that we can help. I'm not hoping to replace any clinicians or physicians, but if we can make that healthcare less confusing, less lonely, I would say today the patients feel and the families feel, if we can help that achieve, that would be a huge win and a success for us.
Is this something we should expect from AWS soon, anytime soon? Any predictions?
I mean, I've, you never know. How about
All right.
that? You never know.
All right. So, say if a healthcare CEO is listening to this podcast right now, what is one question you would have them ask their teams they're not asking?
I would say starting with that workflow question, if they're redesigning that AI and if they're creating that measurable value, um, which workflow are they looking at, right? And the second question, I think what I would really think is, are we using AI to create another artifact, or are we trying to use AI to improve that entire flow of care? I think that distinction matters, because the goal is not to have a better node by itself, but better care experience. So are we trying to automate that old system, or are we redesigning the future one? I think AI, I personally feel, has to move from that innovation lab, whatever we are seeing, like the co-pilots and all of that, to operating plan. I think that's where we're going to see, and hopefully, the CEOs who hear it will see, um, will feel the same with their discussions that they're having with their customers too.
No, I like that because I'm a huge fan of first principles, right? Go down to the most atomic unit of why we do that. And then, let the answers find the answers, right? Versus forcing that, here's a new tool, tech, and then go find a problem, right? We know what happens when that happens. So, all right. Before we jump to the lightning round, was there anything that you wish somebody would ask you?
Um, I wish more people would ask me, what has to change in healthcare itself for AI to truly matter, right? Because again, I think I somewhere referenced, AI is not just better models, not just, but it has to be into that workflow. I think AI is also forcing us to ask those big questions. How can we automate healthcare? How can we redesign? How can we bring in that human piece into the part of the conversation? How can we help build that trust and relationship between the patient and the clinician? I think that great bridge that we need to provide, I think that's what I wish people would ask me, is what has to change in healthcare itself for AI to truly matter in the industry that we're all marching towards.
I believe that lots of people, to your point, at least are very grounded in what you just said, right? Both from, you know, as an investor, how you're funding what you're funding, is there a viability there? And then as a buyer, is there something real and meaningful here? Or is it just one of those new tech tools that we want to develop because it looks sexy, if you will?
Yeah.
Right? Absolutely. All right, let's jump to what I have 10 questions for you. All
All
right.
right.
And you only have either one or two words. Or maybe I'll give you three words in case it's needed. So that's that. All right. What is the biggest misconception Silicon Valley has about healthcare?
Um, I think healthcare is slow because people don't want to innovate, but that's not true. I think healthcare is slow because the stakes are human, right? So that's the biggest misconception.
All right. If AWS gave you unlimited resources for one healthcare moonshot, what would you build?
I would build that health navigation layer for every patient, so that they can connect their records, benefits, medication, follow up, everything into one trusted experience.
Okay. The answers are long, but I'll still give you that. All right. All right. One thing medicine taught you that tech still struggles to understand.
You talked about it, Praveen. I think it's the context that's very powerful.
And what is one consumer experience outside healthcare that we should copy immediately?
I love to travel. We've been to almost 50 countries, not to brag about it, but one thing that has kept us as a family is constantly we love to travel. And I think when I book a flight, I already know my itinerary. I know what the cost, confirmation, what's the next step. If I get delayed, what should I do to change my ticket? Today, I don't think we have that clarity in healthcare. We need that clarity, that would help us.
Good. Bedside or boardroom, where did you learn the most about leadership?
I would say bedside. That's where I learned trust, humility, urgency, accountability. You know,
All right, one AI app that Pratima cannot live without right now.
today it's the Kiro app that I use within my role, and I cannot live without it.
All right, I need to see that Kiro app someday. We'll see. All right,
Yes,
and if you healthcare had a Control Alt Shift Delete button, what would you reboot first?
I would reboot the front door of healthcare, the navigation experience.
All right, if you were not doing medicine or AI, what would you be doing?
Um, I would be an entrepreneur. I come from a business family. I'm probably the only one of them in my entire family who works in an organization. So I'd probably be doing an entrepreneur, either in education or healthcare business.
Cool. All right, what's Pratima's favorite stress response? Running, music, silence, or mindless scrolling?
So if you had asked me 10 years ago, that question would have been, the answer, sorry, would have been running. I used to love running. I've done many marathons. But today, if you ask me, I think I love to go on my walk, just not listen to anything, just paying attention to the whole surrounding. That's my favorite stress response today.
What are you doing this weekend?
Oh, very exciting. I have signed up for my first Spartan race in Monterey Bay, California.
Wow.
So I am very excited. Tomorrow morning, I'm doing it at 9 a.m.
I don't even know what to say. Like, cool. Good luck. Get that badge or the medal, and we'll have you next time.
Thank you.
Pratham, it was such a pleasure to have you here. It was. I think what I'm taking away is some very grounded things that matters to us. Stay in the workflow. Be real about what matters to users, whether they are patient or physicians or someone else. And then I think in some way, I think you also sort of talked about being provocative. Don't just assume things, do that. So love that honesty, love the journey. Thank you.
Thank you. Thanks, Praveen.
Thank you. Yeah, bye.